Hello everyone, it's Amanda Pike from the Maternity Voice Partnership in Lincolnshire, and it's great to be here again for another live Q&A Ask the Midwife session. And today we're going to have Yvonne McGrath joining us, who is the consultant midwife. Sorry, little ones making noise. I'll be getting her on in a second, so I'll just tell you a little bit about what I'm doing. At the minute, we've got the Mum and Baby app that's just launched this week, which is a fantastic app that anybody that's pregnant really should download and take a good look through. It's still a work in progress, so if you've got any feedback on it, send it in to us. We'd love to hear, because they want to try and improve it as it goes along. And on the 17th of December, the Maternity Voice Partnership are having our first listing event. So we'll have a virtual meeting and anybody can attend, and we can have a chat. You can meet us and we can talk about your journeys, or if you've got any ideas or feedback, or just have a general chit chat. So it'd be great if some of you could join in. If you message the Facebook page or the Better Births page, or email linksmvp@gmail.com, I can send you the link to join us on that day. Okay, so with that all said, I shall add in Yvonne.
Hello.
Good morning. How are you? Well, afternoon now. How are you today?
I'm good, thank you. How are you?
Oh, I'm brilliant, thank you. So you're going to talk a bit today about home births and water births.
Yeah.
I'll let you take it away.
Fab. So today we thought we'd talk a little bit about home birth, which I think has come up a little bit more for women as a topic in terms of COVID and things like that. People have thought about it a little bit differently. And sometimes there's a lot of misconceptions about home birth, about whether it's a safe option or not. And we actually have lots of really good evidence to support home birth. So within the UK, we had a piece of research done that was published. It'll be the 10-year anniversary of it next year, for the Birthplace study, that indicated that for women having their second or subsequent baby, that the outcomes for baby were exactly the same at home, but the maternal outcomes were arguably better, more straightforward births, less likely to have a cesarean, etc. For women having their first baby, that study showed that there was a increased risk of an adverse outcome with the baby. It's still a relatively overall a smallish risk, but it's a greater risk than being in hospital or in a midwifery-led unit. That doesn't mean it's not the right option for women having their first baby, but it's a different set of decisions based on that research. And then the Lancet, over the last couple of years, has published a huge international review paper. So this is where they pulled studies from lots of different places together and look at all of the outcomes. And there was almost 500,000 babies and 500,000 women included in this review. So huge number. And what that told us is that the outcomes for mum and baby were safe. So for women who are at low risk of complications, that home birth was a very safe option. And in fact, the Lancet papers for women booked to have a home birth. That doesn't mean that they necessarily ended up birthing at home, but booked to have a home birth were 40% less likely to need a cesarean, 50% less likely to need help with forceps or a suction cup to have their baby, 55% less likely to have an episiotomy, 40% less likely to have a third or fourth degree care, and 75% less likely to have an infection if they ended up that compared to women who gave birth in hospital. This is matched with women who are similar to those women. So it's not looking at high-risk women in hospital compared to low-risk women. It's looking at low-risk women in different settings. So I guess in summary, it is a safe option for low-risk women. And some of the advantages can be, and birth is about where you're going to feel safer. So this is not going to be the right choice for every woman, but it can be a really good choice for lots of women. And sometimes it's something that people don't consider. So especially for women who've maybe had a really straightforward birth the first time, it's really worth considering whether it might be nicer to have the midwives come to you, how you might like to get into your own bed after you've had your baby. So women can feel more comfortable in their home environment and You can have your other children around, etc. So there's some of the things that can be, real big pros. And the midwives come to you. You don't have to do that journey in the car in labour. And in terms of kind of women often worry, is it going to be very messy? Am I going to never go to look at my front room again because it's going to be messy? And the answer is no. The midwives take everything away. If you choose to have a home birth, you'll be guided on kind of what to have available in your house so that you can, protect carpets, etc. But birth isn't as messy as it might seem. And anything that needs to be taken away will be taken away by the midwives. So it can be a really good option. And if you're even vaguely interested, have a chat with your midwife about it. And the great thing about it is you can change your mind. Just because you plan a home birth, if in labour you think, do you know what, this isn't for me, I want to change my mind, you can at any point. You're not committed to going through with it if it then doesn't feel right. And in terms of transfer rates, so for first-time mums, transfer rates are relatively high. So about 40% of women having their first baby will require transfer to hospital. What's important to remember the other way around is that means 60% of women who plan a home birth for their first baby will birth at home. So we can sometimes think, 40% transferring in sounds like a lot, but that means 60% of women birth their baby at home when having their first baby. But women having their second baby, about 1 in 10, so 10% of women transfer in. So about 9 out of 10 or 90% will birth their babies at home in an uncomplicated fashion. And true emergencies at home are fairly rare. I think people often worry about that emergency at home, but the most common reasons for transfer are that labour is slow, rather than it being a really, 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 really dire emergency. So the most common reason is that things are slow, which in and of itself is identifiable. And most transfers are very calm. You transfer in and it's calm. So it is a really, an option that can be really right for lots of women. And it's worth considering if you haven't considered it before, and putting by some of your preconceptions if you fit into that kind of low risk category. And I was going to talk a little bit about water birth as well, and kind of
I was going to say, you can have a pool, can't you, at your home birth?
Pool, and we have a fabulous pool scheme in Lincolnshire where you can hire a pool for £25. It will come to your house. It's a very easy system. We know that they're all cleaned correctly and up to the standards that they need to be. And water, both at home or in hospital, is a fabulous option for analgesia in labour. And water is available for women who sit outside of a low risk category. We have a guideline that supports that. Some women will need a plan antenatally. So again, talk to your midwife or obstetrician about that. But we really want to support as many women as possible to use water in labour. And it's very, very good analgesia. It's not so much about whether the baby's born in the pool or not, but it's just having that comfort of being in water. And I think for lots of women, water is a nice, comforting thing. So using water in labour can feel great. Baths are also great, but water can be fantastic. Having a pool at home, again, it's not as much of a faff as everybody thinks it is. The kits that come make it very easy. You just need to have a space that's safe and accessible for the midwives to be able to get around a reasonable amount of the pool. And water is that really comforting thing. So it's well worth thinking about, and in a hospital setting too. So yeah, there are just a few bits and pieces about home birth and water birth. I talk about her here till 5 o'clock, but
that's okay. Can I ask a question? Are there any other types of analgesia that people could use while they're having a home birth?
Yeah, absolutely. So the midwife will bring gas and air, so Entonox, and women can arrange to have pethidine or diamorphine at home. That is possible to do. It's not common, but it is possible to do that. And also all of the other things that can be used, like relaxation, hypnobirthing, can be used in any setting. Massage can be also be used at home. So the only thing you can't have at home is an epidural. The only thing that's not available.
Yeah. Okay, brilliant. Thanks for all that. That's really interesting. I know lots of people that have had home births, and I hear the most beautiful and magical stories. It's not often I've heard anything that's negative. They all seem to, really rate and want to promote their experience. It's
And
lovely.
I think women who have to transfer in labour usually look back on the part of their labour that was at home in a very favourable way.
Okay, well, that's good.
In my
That's
experience.
lovely. Yeah, what more do we want from that? That's fantastic. So there's a couple of comments in the chat box. While I go on, when we mentioned the pools, I know some of the Better Births team are around. If they could link to maybe the birth pools, that would be great. If they can't find it, I'll do it later. I'm sure they won't mind. So yeah, we'll get that sorted. So if you're interested in the pools for home, and I think you can also hire a TENS machine with it now as well. So yeah, I'll get that in the box for you. So Sophie writes, I'd love a home birth, but didn't have a good labour with my first. Is there any comments that you could make?
Without knowing more information, it's difficult. But second babies are generally, even if there has been some complexities and lots of caveats there because I don't know what happened, but generally second babies are more straightforward. So even if you required, and again, lots of caveats, depending on what happened in your first birth, you may be a very, very suitable candidate for a home birth. Have a chat with your midwife, and then if you need more information, they can give it to you or signpost you to me if there's something that needs more of a plan.
Okay, great, thanks. So Helen Renton writes in the chat box, how do you support women who choose a home birth against medical advice?
So we will do personalised plans for women who have got risk factors that would mean a home birth isn't recommended, aligned to the guidelines. So we support lots of women to make those choices and put plans in place to support them.
Great, thank you. Right, Amy writes, I had a water birth with my second at Pilgrim in June and it was amazing. Highly recommend. That's great to hear. You often hear that about water births.
Yeah, kind of.
Yeah. Right. I'll be having a home birth at the end of March, beginning of April. Well, Beth, we hope it goes well for you. Sounds like it's going to be a lovely experience. Good luck with that. Vicky writes, I had a water birth with my first 2 years ago and would do it that way again every time if I could. It was so relaxing and I would definitely recommend it. Oh, lots of recommendations. That's brilliant. Okay, Taylor writes, can you have a VBAC home birth? Second baby, low risk first, was chosen elective section, low risk.
So it would be outside of guidelines for a variety of reasons. So we would recommend birth in hospital for a woman who's had a previous cesarean because of the risk of the scar coming apart during labour. And the chance of that happening is about 1 in 200. So we recommend continuous electronic fetal monitoring. So that's the monitor that continuously monitors the baby's heartbeat with kind of the 2 discs that go on your abdomen. And that's because that's the best tool we have for determining if anything is happening with the scar. And it's a very unpredictable event. We can't predict which women it will happen to and which women it can't. And we also can't predict how much of an emergency it will be. So about a third of cases, mum and baby will be absolutely fine where it happens. So of that 1 in 200, about a third of those, mum and baby will be completely fine. And about a third, mum and baby may need some extra support beyond if it had been a straightforward experience. And then in about 1/3, there may be more serious consequences. So of the 1 in 200. So these are all very small chances, but they're serious chances if you're in that category. That is that third of that 1 out of 200. So that's why we would recommend birthing in hospital. However, it is your choice, and we would have a good discussion about why that felt like the right choice for you, whether there was something that would make hospital feel more appealing. But if you made that choice in an informed way, we would do a really good plan to support you and support the midwife. So it would be against the guidelines for the reasons I've just outlined. However, it is absolutely your choice to make those decisions, because it isn't just about that decision. There will be other things that factor into why women make particular decisions that are right or wrong for them. So it's quite a complex answer, I suppose.
Yeah.
So talk to your midwife, and then and have a good discussion from there. Talk to your obstetrician, and then we take it from there. I hope that answers it.
Thank you, Yvonne. Okay, so Sophie finished off part of what she was saying. So she said she'd loved one before. We didn't have a lot of information, so she's put thank you. It was preeclampsia, second baby was blood loss. This is my 6th baby. She's due on the 16th of December.
So she needs to have a chat with her obstetrician and take it from there.
Best of luck with the birth coming up soon for you. That'd be lovely, a little Christmas present for you. Okay, and the Better Births have popped the link for the pools and the TENS machine in the chat box for anybody that needs it. So Katie writes, I have to have a section for medical reasons. I did with my first, but my husband could stay and help. Obviously with COVID, and also with having my daughter now, he can't stay with me. Is there much support for the initial period after the section, i.e. help to change your baby, getting them out of the crib or rocking them, etc., if they need it?
Yeah, the staff and the maternity support workers and the midwives will absolutely help you at that.
Yeah. I had a baby during not during a pandemic, and they still did that for me. I think that's just part and parcel of what you guys do, isn't it? Yeah, so that's great. Right, Beth, would there be early warning signs that midwives are trained to notice to allow for time for transfer for women having a home birth VBAC?
So again, it's back to this unpredictability. And I have personally supported quite a few women to have VBACs at home, and the issue is the unpredictability. So you may not get clear signs until it's quite late on. You might get some indications earlier. So it is that unpredictability of that particular complication that makes it difficult. The birthplace study the study I referred to at the very beginning, did kind of drill down into, they also looked at women who were had risk factors that chose home births, and one of them was previous cesarean, having a home birth, and they concluded from that they would recommend hospital birth, but because the numbers we had were really small to be able to apply it. So in that small sample, the transfer rate was high. The transfer rate was higher than first time mums planning a home birth if a woman hadn't had a vaginal birth too. So if it was someone who'd had one cesarean and was then trying for a VBAC. If someone had had a cesarean, then a vaginal birth, and was then opting for home birth, the transfer rate was less, which makes sense. So it's just a really difficult one because of the unpredictability. So it needs a very individualized discussion and counselling around it.
Great, thank you. Just to explain, VBAC, am I right in thinking it means vaginal birth after cesarean? Is that correct?
Absolutely.
Just in case anybody who's watching and didn't know what that meant. Okay, so Charlotte writes, I'm planning on having a home water birth in April. I'm taking as a midwife, I think she means I'm taking it a midwife will come with resuscitation equipment for baby if there are any issues.
Yeah. So the midwives carry quite a lot of emergency equipment. They will set up an area in your home where as a sort of resuscitation area, like the resuscitation areas that we have in a hospital. So they can do all of the same basic resuscitation that we would do in hospital. And it's very, very unusual to have to resuscitate a baby at home. I've done a lot of home births, but it's very unusual. But we carry all of it, and everyone is trained to do what's called neonatal life support, which is how we resuscitate babies. So they would set up an area in your house. They're equally equipped that if you have heavy bleeding at home, they will have the initial drugs that are required and other things that can help treat heavy bleeding, like catheters to empty your bladder, because the bladder can sometimes be what impacts on bleeding. That all be carried. The midwives will organize all of their equipment so that they have all of that on hand. So you absolutely, you get 2 midwives for your birth. You have all the correct emergency equipment. All of the monitoring that we do is the same. So if you are a low risk woman at home or you're a low risk woman in hospital, the actual monitoring and care you get is the same. And all of the initial emergency equipment is the same. And again, we're talking about women who are generally at a low risk of complications. The complications are not going to occur super frequently to the point where, where it's something to be overly worried about. We absolutely want to make sure we've got all our bases covered, but it is unusual to resuscitate a baby at home, for example.
Okay, that's positive to hear. Yeah. So Beth writes, are birth packs delivered to home with gas and air before labour, or do the midwives bring everything with them when the time comes?
In most areas, the midwives bring everything with them on the day. There are some of the teams do leave a few things beforehand, but most of them bring it on the day.
Okay. And Danny writes, not keen on a water birth, but reading good things about labour in water. Are there facilities at hospitals, like a bath? I don't want to take up space when someone else would like to have a water birth.
There are baths and showers can be really useful as well. Equally, you may find that in labour the pool looks appealing, and don't feel like you're depriving someone else of it. If you're offered it and it's what feels right at the time, feel free to take it and don't worry about it.
Yeah. And Charlotte, who's replied to you answering her question, says thank you. She's has a medical background, so just something that she wanted to ask. Okay, so I'll if anybody else has got any questions, if you pop them into the chat box, I'm going to revert to the ones that we've had sent in for now. So yeah, just pop them in the chat box and I shall keep checking. So can I take contraception if I'm breastfeeding?
Yes, and I think this has come up a couple of times, hasn't it, Amanda?
Yeah, we get this one regularly.
Yeah, breastfeeding itself is not a form of contraception, so if you don't want to get pregnant while breastfeeding, you do need to think about contraceptive options, and it's worth talking to your GP. There are certain things that are not suitable, but many forms of contraception are suitable.
Great. Okay. I'm worrying that my baby is moving less. I'm feeling her, just not as much as I usually do. Should I contact my midwife? I know they must be busy at this moment and don't want to trouble them needlessly, as I can feel her.
If you have concerns about changes in your baby's movements, that is not something to sit at home thinking about. You need to call midwives and you need to be seen. So please don't worry about us being busy. What we're there for is to see you in these situations. So please contact your midwife if you have any concerns about your baby's movements. Really important.
Yeah, and something I've got out of these Q&As that we've been doing for a number of weeks now is that you guys never mind how many times a woman has to ring you. If it's more than once, that's absolutely fine.
Absolutely. That's what we're there for. We would rather see you 10 times than have you sitting at home worrying.
Yeah. Right. Do I need a contraption to help me pump my milk, or would hand expressing work?
Hand expressing will work, especially, it really depends what your intentions are, but hand expressing in the first instance will absolutely work. Many women, if they're pumping on a more regular basis, you will want to get a pump for efficiency, but in terms of being able to manage your breast comfortably, hand expression will work absolutely fine. And some women are really good at it and will never use a pump, and they find it fine to do it that way. So you don't need to buy a pump, but some women, if they're pumping, removing milk regularly in large volumes, find a pump easier and quicker.
Yeah, cuts out on the achy hand.
Yeah.
My baby's head centile is coming up bigger than his length. At scans, nothing has been said, but should I be concerned, and will I be able to push him out?
So if there was a concern that there was a difference that was of large concern, they would have discussed it with you. Babies' heads in labour are designed to mould.
Sorry, a bead come running across the thing and I thought it was a spider. I'm so sorry. Carry on.
Babies' heads are designed to mould and shape to enable them to be born, which is why you see babies with sort of slightly funny shaped heads when they're born, and that's because babies their heads will mold to the shape of your pelvis to be able to come through.
Great, thank you. So I'm just there's a comment here. I had a little girl from Vicky again. I had a little girl on the 24th. Her belly button cord came off on the 29th. On average, how long does it take to heal, please? Oh, congratulations, Vicky. You've been on our lives for weeks. I've just realised. That's lovely news.
It varies a little bit, but most of them heal by sort of around day 10. But it does vary a lot. But as long as it's just, you know, clean, just leave it alone and it will heal. Babies heal really quickly.
Great, thank you. My friend's nan said that she used to put rice in her baby's bottles to help them sleep. I feel like this may be a silly question with the nan being so old, but if I did it, would it help, or is it dangerous?
It's dangerous and not recommended at all. The only things that we should be feeding babies are breast milk from a breast or in a bottle, or formula, first milk in a bottle that's been made up correctly. We shouldn't be giving babies anything else at all. And when I say babies, I'm talking pre-weaning babies, obviously.
Yes. Yeah. Right. I keep feeling really teary and low. I'm 32 weeks pregnant and it's a horrible feeling. Will this last? I'm assuming it's hormones.
So if you're feeling low and feeling concerned about your mental health, please talk to your midwife or your GP, because there is services there that you can access. I think this year has been really hard on lots of people, and adding in pregnancy and other life-changing events can make it more difficult. So really important, if you feel like it's becoming something more significant in your life and difficult to deal with, that you talk to your midwife and GP and access help as required.
Thank you, Yvonne. Louise writes, when will my morning sickness stop, and what can help me to relieve it?
So most women, as they get into their second trimester, improves. Some women will have morning sickness that is persistent throughout their pregnancy. If it's very severe, medications can help. Otherwise, and it's playing around with what's going to work for you around foods. There isn't any magic solutions to what will work for an individual person. So if it's mild morning sickness, just experimenting with when you eat and so on may help. If it's very, very persistent to the point that you're struggling to keep anything down, then we begin looking at some medications that are safe for pregnancy.
Okay. Thank you. When will a midwife listen into my baby's heart? I'm only a few weeks old, but I'm very excited.
So we don't listen in antenatally routinely, but the NICE guidelines, which are the guidelines that care is based on, don't recommend doing so, because the most reassuring sign that your baby is well is your baby's movement. So listening in for 1 minute during an antenatal appointment has limited value in telling us about your baby's well-being. You will get to see your baby at your scan, and you will get your first scan and your 20-week scan. And after 25, 26 weeks, if you want to ask your midwife when you see her to listen to the baby's heartbeat, you can request it.
Great, thanks. And actually, I've got another question that we get, another one that's quite regularly, but I'll ask it again because it's quite apt to what we've just spoken about. So, is it safe to buy a Doppler? Lots of people have them in my baby group, but I thought they weren't safe. I'm not sure what to do.
And please do not buy or use a Doppler. You may not know what you're listening to. You may be falsely reassured. If you are concerned, you need to call us and talk to us and probably see us. This is not a tool for reassurance for you. You could be listening to something thinking it was your baby's heartbeat, and it may not be. So it can be very falsely reassuring. So it's really, really important not to be doing that yourself at home. So please save your money, buy something else. Don't spend it on a Doppler.
No. Right. I live with my mum. She's a heavy smoker. I have cut down, but I still smoke too. Is there anything that I can do to help myself to stop? It's so hard, but I know that I have to.
So your midwife can refer you for smoking cessation support. Your mum can also, if she's prepared to attend for smoking cessation support as well, because in terms of long-term health, smoking has an impact once the baby is born as well, not just while you're pregnant. So living in a smoky environment is quite unsafe. Well, it is unsafe for baby in terms of risk of cot death and so on. So it's a really important topic in terms of safety of your baby, and as well as short and long-term health. So I'd really encourage you to talk to your midwife about getting some additional support and having that conversation with your mum as well about whether she would be happy to have that support. And we know it's really, really difficult. And the things I've said, I'm not saying them to be scary. They're just the reality. So if your mum was willing to also access smoking cessation, there is those services available as well.
And it's great to know that actually family members can access it as well. I wasn't aware of that, so that's wonderful. Right, couple. I'll ask 2 more questions and then we'll end. So if anybody's got any, please send them in now. Right. Tammy sent a message in saying, I keep panicking about the birth. This is my first, so I understand it may be the fear of the unknown. But do you have any tips to help me relax and not worry as much?
So hypnobirthing can be a really useful tool and it doesn't matter what kind of birth you have. I think sometimes hypnobirthing is perceived as being for certain types of births, and it's not. So hypnobirthing can give you a toolbox of some relaxation techniques that can be used for regardless of what kind of birth you have. Also, finding out more about birth, so learning more about the anatomy and physiology of birth can be really useful as well, so that you understand more. Sometimes the fear of the unknown is because you don't know enough yet. So learning more about the anatomy and physiology of labour and birth can be really useful as well.
Great, thank you. Oh, Danielle's just popped a question in and said, how long can dad stay after birth at the moment?
At the moment, while you're on labour ward, they can stay with you for that entire time. And once you go to the ward, they can book to visit in 3-hourly slots.
Great, thank you. And I'll ask one more. Does my baby have to have the vitamin K injection after birth? And what is it for exactly?
So the vitamin K injection is around preventing bleeding in the newborn because of lower levels of vitamin K. It's recommended that it's given by injection. It can be given orally, but it's given in multiple doses. And the recommendation for giving it by injection is that it's all absorbed, whereas babies often spit things out when you put things in their mouths when they're little.
Yeah.
So you don't have to have it, but it is recommended because of reducing this chance of serious bleeding in a newborn. But again, have a conversation with your midwife about get a little bit more information about it.
Brilliant. And I'm going to sneak a last one in because it seems silly not to. Tyler's popped another one in saying, if you express colostrum and freeze in syringes ahead of birth, will the hospital keep frozen for you once you come in for labour so that you can use it afterwards for baby? I want to breastfeed this time, but bringing in colostrum in case of latching issues, etc.
Yeah, if you bring it in, your midwife should be able to have given you a kit that has labels on it, and you label it so it's all correctly labeled about when it was frozen and when it was, how, all that sort of thing. And you can bring that in with you, and it will go in the appropriate fridge freezer when you come in. Absolutely, can bring it in.
Brilliant. Yvonne, as ever, thank you so much for joining us today. You are just a mind of information. And if anybody's got any questions, then we shall be back in another 2 weeks. I'm not sure, actually, on the 11th, I should have mentioned, the 11th of December, we are having Linda Hunn, who is coming to talk about the transferring of preterm babies, because sometimes when they're really little, they go to other areas. So she's coming on to talk about that along with Georgina Gold again, so that'd be great. And then another week after that we'll have another live Q&A. So I'm not sure if it'll be you or not yet, Yvonne, but whoever it is, it'll be great to have them back. The Mum and Baby app link is in the description for this video. And don't forget to send us a message if you'd like to join in on our MVP listening event. It's a virtual meeting where we're just going to have a bit of a chat. It'd be great to meet some of you. Thanks again. Have a great weekend, and we'll see you soon, everybody. Thanks for your time. Bye.